Hello friends, in this video I shall speak to you about a test which is retrograde urethrogram and micturating cystourethrogram, which is absolutely essential for diagnosis making of post pelvic fracture urethral injury and also for the exact surgical planning of the case. But it is very important for you to have a meaningful test. That test is done at the right time and that there are certain precautions that you take while ordering for the test. So I call them as some do's and don'ts prior to RUG and MCUG for diagnosis of post pelvic fracture urethral injury in males. First thing is that you have an informed consent from the patient. It is very important. The radiology centers often omit that step, but it is the duty of the treating urologist to obtain informed consent, and you must touch certain points. Like after the test, the patient may have some degree of urethral pain and some bleeding from the urethral orifice, which mostly settles on its own in 2-3 days' time. Secondly, from the urine coming through the suprapubic catheter, there can be blood. It can become blood stained. And this also settles in due course of time, but patient gets very startled when they see this happening. And thirdly, you should tell your patient that although all the precautions will be taken, but still you can have urinary tract infection coming up as either pyelonephritis or cystitis or even epididymoarchitis. Then the next questions which are related to this, that if you tell the patient that there may be some urinary infection after the test, the patient will obviously ask you how to prevent exacerbation of urinary tract infection. Then the second question which patient may ask you, when should I go for this test? What are the timing of the test? Should I go right now or should I go after a week or sometime later? While the test is being done, it is important for you to ensure that whatever contrast is filled in the urinary bladder does not leak out by the side of the catheter. It not only makes the procedure messy, but it can sometimes stain the skin of the patient, the X-ray table, and create, lots of issues. And then most important thing, sometimes when MCUG is done for pelvic fracture urethral injury cases, the bladder neck does not open nicely and contrast does not fill in the prostatic urethra. So can you do something about this? How to facilitate opening of bladder neck during MCUG? So these are 4 questions that are in front of us. Talking about the first, how to prevent exacerbation of urinary tract infection during the test. You should ask for a urine culture and sensitivity report, and sample is collected from suprapubic catheter, and you should cover this test with appropriate antibiotic as is shown in the culture and sensitivity report. That is one thing that you should do always. Second precaution is, if the suprapubic catheter is old, it has been indwelling for over 2 to 3 weeks time, then it is advisable to change the catheter at least 1 or 2 days before the test. because the old catheter gets colonized, and when you push contrast through that, entire bacterial load will go in the urinary bladder. If you have fresh catheter, that will not happen. Also, when you examine the patient, if at that time patient is having symptoms of urinary tract infection like a fever or turbid urine or even odorous urine, then you should refrain from doing this test. And once the test has been done, you should tell that if patient gets any symptom of urinary tract infection, he should report back to you as soon as possible, because often these bacteria in the bladder are drug resistant and they are polymicrobial pathogens. So patients sometimes have very bad urinary tract infection. So if you start treating the symptomatic UTI, sooner you treat it, the better it is for the patient. The second question, what should be the timing of doing this test? In this patient, you notice a fracture here in the ischial ramus. You also notice a fracture here in the pubic ramus, and you also see the opening of the sacroiliac joint. So these are the findings that you see in the plain film. It's okay. It does not matter. Timing does not matter for a plain film. But if you do a micturating cystourethrogram, the contrast has been filled in from the bladder, and you notice that lot of it has extravasated from this end. It has gone all over here, and it is spoiling the picture. Same patients, when retrograde urethrogram is done, this extravasation is spoiling the picture. And also you should know, when this contrast extravasates, this may spark up pain, fever, and even abscess formation. This happens because you've done the X-ray very soon after the injury, maybe 2 weeks, maybe 3 weeks after the injury. There's no need to do an MCU, RGU 2 weeks, 3 weeks after the injury. Wait at least 4 to 6 weeks. Either patient, this MCU has been done, and look at this, all the contrast which is extravasated all over and has apparently spoiling the picture quality. And this is the retrograde urethrogram of the same patient, extravasation here and there. So this only tells you that the injury is still raw and it is extravasating, right? So I see no point in documenting this, that there is extravasation. So it is better therefore to wait for some weeks rather than do the test early. The second reason for you to wait is that if you see this patient's MCU, and if you see the bladder neck here, and this is pubic symphysis, there's so much of distance here because probably the bladder is sitting on the top of the pelvic hematoma. When you see this RGU and MCU, the distance between this end of the urethra and this end of urethra is so much. And this is because the bladder is sitting on top of the pelvic hematoma. This is the MCU of the same patient after waiting for 6 more weeks. And now you will see that the bladder neck has come at the normal position. So this is the second reason for you not to do an MCU very early after the injury. So friends, what is a good timing for a radiographic evaluation of PFUI? You want absence of extravasation and you want resolution of hematoma, and after that you want to do the test. And usually this is 3 months post injury. The third question: how to prevent leakage of contrast by the side of suprapubic catheter when the MCUG is being done. This is the catheter and this is the suprapubic insertion site. Often you will notice some granulation tissue by the side of suprapubic catheter, and the contrast may leak from here. In order to prevent the leakage of contrast, what we should do, somebody should pull the suprapubic catheter so that the balloon which is inside here, if you see here, this is the suprapubic catheter and it is going inwards right here, and then inside the bladder, there is a balloon, right? Now when you tug this catheter out, what will happen will be that your balloon will come and tamponade here. And this, the tug of the balloon will prevent leakage of contrast by the side of the catheter. So what you should do is that you tug it up and fix it with a adhesive bandage. And if you want more tugging pressure here, you can put in a roller bandage underneath here. This will maintain the tug. The fourth thing, if you are doing MCUG and patient fails to void during the test, or patient fails to fill up the prostatic urethra, your information is lacking. So how can you facilitate opening of bladder neck during MCUG? Here is a patient who did this cystourethrogram, given instruction to void, but he did not void and therefore the bladder neck did not open. So we looked at this problem in our center and we gave these patients cystourethrogram, which is an alpha blocker, short acting in duration, 8 milligram given, it relaxes the bladder neck. And after about 2 hours, when we repeated this test, this time patient was able to open the bladder neck and urethra was visible. This time patient was able to open the bladder neck and urethra became nicely visible. So we did this in some of our patients and we published this paper long time back in 2013 in Urology Journal. Single dose cystourethrogram prior to VCUG, a pharmacological adjunct to enhance visualization of prostatic urethra. And this is the PDF. So I hope you have got answer to this question. What are the important do's and don'ts prior to you do a radiographic evaluation for PFUI? Thank you very much. In case you have any questions or comments, please write on my email.